Okay. Good morning. Oh, hey. Somebody said good morning to me on Zoom, and they were really excited, so it made me very happy. So I know people are on Zoom like, what? Good morning. Good morning. So I want to first welcome you to the network. For those of you, my name is who know me. You know my name is Ailey, but for those of you that might be joining us and don't know me, my name is Ailey Pope, and I'm the Vice President of Service. We are so excited to have you here with us in the room, and to those of you on Zoom watching. We are halfway through the year this year at the network, and it has been an exciting year so far. Each of you continues to make an impact and allow us to be a part of that impact by serving your organization. Today, we are spending time with our dynamic data divas and our analytics team, examining the 24/1 community needs through data, which is so important to our work. Hillary Mason, a data scientist and founder of Fast Forward Labs, once said, "The core advantage of data is that it tells you something about the world that you didn't know before. Data informs us about the world around us, and it gives us the tools to tell our stories." So today, ask questions, Zoom, ask questions, engage, and jump in wherever you see fit. This is a space where you can feel free to build. As always, it is a pleasure to serve each of you as network members, and we look forward to the rest of the year. Without further ado, I welcome the dynamic data divas, Morgan and Courtney.
Oh, thank you, Ailey. It is always nice to get an intro like that. That's hard to beat. So thanks, Ailey, for joining us for a minute. Thanks to all of you for joining us, both here in person, and I know we've got multiple people online. I know everyone's busy, so thanks for taking time on a Friday morning to come out and have some breakfast and talk data in the 24/1. So as Ailey already said, welcome to the network. We serve our members by listening to you all and community stakeholders to shape how we serve. We like to collaborate, and I'm hoping that's what's going to happen today around the shared objectives we have to serving our community. And we like to invest in financial, strategic, and organizational resources in our priority areas. And today we're going to be talking about some new data resources as well as existing ones that maybe you haven't or aren't aware of. And also we hope to get some feedback from all of you about what else you feel like is needed that would further your work. So with that in mind, we're just going to kind of jump in. We're going to have a mix today of some discussion. So I hope you guys are ready to maybe grab some more coffee, grab some more breakfast, have a little discussion. And then Morgan and I will do a little bit of presenting, not too much. And then we will also be demoing a couple of things online for you guys today. So with that in mind, I will just quickly introduce myself and Morgan. We are I usually call us the data team, but it's hard not to, love the data diva title as well. So I think Alice actually started calling me that last year, Alice on our service team. So, so Morgan and I it's so exciting to have Morgan. She's been here for about 6 months now. So I used to be a team of one, and now we are a real team, not just one. And for those of you who don't know me, my background is mostly in geospatial data. Prior to coming to the network, I was the county data officer for St. Louis County. So I worked with a large number of data systems there throughout all of the different departments in the county. So as you can imagine, that was a very different data landscape than then coming to a small org, but a lot of what translates there with working with different departments kind of comes into play here with getting to work with so many different organizations at the network. And then when Morgan speaks in a little bit, I'll let her kind of give her intro, but I think of her as our Salesforce guru. She has already really optimized our Salesforce implementation and improved it in just huge ways. And we are hoping to really serve as a resource for all of our members who use Salesforce. I think you can think of Morgan as just like a great technical resource there. So we'll have a little discussion here in a minute. And then Morgan and I, she'll be talking about utilizing data. I'll be going through some data resources. And then at the end, we do have a very quick survey that we're going to ask you guys to take because we want to get some guidance on what else is needed, what you guys would like to see at future data-focused events and or trainings. Some of you were probably here last year. We had a qualitative data training that was led by some UMSL staff from their Community Impact or Community Innovation and Action Center. And that was really great. And that was a result of our data training we did last year where people said that was what they were interested in. And so I'm not a qualitative data person. I'm very much the quantitative type. But we were able to get people in here who have that expertise. And I think everyone who came really enjoyed it. So it's a similar type of thing. If there's something you guys want to see and that will help you serve the 24/1 better, we want to bring those resources in and help you guys have that available to you. So I'm hoping today that maybe not everyone here really thinks of themselves as a data person. I'm hoping a few of you came that maybe are like, it's the network meeting. Sure, I'll go. I think in the past when we kind of framed it as a data training, which was great. And we kind of got into the weeds of more like data systems and stuff. We're not going to do that today because I think when people think data, they think, like this woman here looking at her big monitors with the spreadsheets. You're thinking of lines of code. I feel like the bottom right is a very relatable picture where the guy's got his head in his hands. I think we've all been there, whether it's data or not on our screen. But I'm going to encourage you to, no matter what your role is, to think of yourself as a data person. We all consume data every day. Probably check your phone to see what's the temperature in the morning, check the weather. You're driving in your car, you're looking at data all the time. We all produce data, both as just in our like daily personal lives, especially if you have a smartphone, the whole saying of if the product is free, you're the product. So every time you use Google or social media or whatever, they're collecting data about you. So you're producing data. And then we all leverage data to make decisions, right? And so hopefully, I think all of our organizations are trying to use data to make well-informed decisions about the communities we serve, about where we should direct resources, that type of thing. So everyone is a data person. And I think people just often don't think of themselves that way. If you are someone who does frontline service or manages a team of frontline service, when you're doing case management, that's data because you're collecting information about that interaction you had with that client. You're collecting information about, who that client is, about what service did you provide, later about that outcome. And so, I think data is really important. It helps tell the story. I think people often can think that it kind of can dehumanize the work we do, but I really believe that what it does instead is it enhances the storytelling that you're able to do about the importance of your work. It is so impactful sometimes to hear numbers, I think, about number of people served or the how you're able to move the needle on a problem. And it doesn't diminish the personal aspect. I think we all love hearing those very individualized anecdotal stories as well. And I think it all comes together to make like one big picture about the work you guys are doing. So I love data, obviously. I would encourage you all to hopefully, maybe get a little bit more of an appreciation for it today. So what I'd like to do to kind of start us off is you guys are already at tables, so you can maybe break into little groups by your table, but feel free to move around if maybe you also would like to sit with maybe different people that you don't know or whatever, but just get in little groups of 3 or 4 and you can introduce yourself. And then I'm thinking we'll have maybe about 10 minutes or so that you guys can also take a chance for everyone who's here in person. We have lots of breakfast over here from Einstein Bagels. There's coffee. There's like sandwiches, fruit, all sorts of stuff. So when we break off in a moment, I'll give you guys a couple of minutes to go grab more refreshments. And then when you come back to your little pods, I'd like you guys to discuss with each other what's a data challenge that you or your organization are facing and what resources in an ideal world could make an immediate impact on that. And then maybe you guys will find some common ground, or maybe you'll find someone in your pod who's dealt with that. And then we'll just have a little report out back because I think it can be really valuable. I've done this exercise at other data events to hear. Sometimes you often kind of unknowingly will run into someone with the same problem as you, or someone who will say like, oh, I know exactly how to fix that. And sometimes it's easy. So that's always nice. So I'm going to give you guys, I think we will, maybe Seth, if you can turn some tunes back on low. And for our Zoom people, I think Alex is going to help moderate that so that you guys can also do some online chatting. And I'll give you guys about 10 minutes and we'll report back and then we'll get into the next part. Yes. Oh, so they're up on the street. What is a data challenge you're facing? And then what resources would help you meet that challenge? Yes. Yep. Yeah. All right. You guys get some caffeine, get some bagels, and let's talk data.
Good.
Right.
So I do down. Yeah.
Okay, I think we hit actually I think more like 11 minutes. I was just having so much fun talking. So let's see. I'm going to get one of these mics turned on so that we can hear from you all. And okay, I think it is on. So, what pod wants to be the brave volunteer to go first? And maybe you can just tell us maybe if you had common themes or if you have specific data challenge you guys want to highlight or challenges in your group. And also love to hear like what resources or solutions you guys talked about. Yep.
Good morning, everybody.
Good morning.
All right. We talked about in our pod the challenges. Our challenge is how do we collectively tell our story? So our challenge, the challenge that we discuss is a narrative challenge, so but particularly when in the face of all of the negative stories that come out, we need to be in control or be able to balance it with our own narratives that tell the positive. And also, let me see, help me out? What else did we say? Is that good? Oh, collecting data from teachers as well. Man, that was something I was going to say about that. People telling our stories. People, that's what we said was the resource, is people telling our stories. Dr. Harris gave the example of in Rockwood, they had more than enough people to track specific points of data. And so they were really good at tracking that and being able to tell their stories. But in a school district like Normandy, we don't have that many people to be able to do that kind of tracking. And so the resource that we're lacking is people to be able to do that. And so does that sound right? Okay, thank you.
Do you guys think, is it a literally just number of people and hours in the day, or is it also like a training issue with staff, or maybe both?
I think it's, I think so.
With some of the work that you guys are doing at the network, hopefully this will be resolved. You have some really wonderful, amazing organizations that are part of the community, right? Mm-hmm. But then they're probably TLC. We have a staff of 4.
Yeah. Yeah.
You can train us all day long, and I'm sure we can do it. But when those kids walk in, then that's where we're focused. Or if we have to try to go to find money, then, you know what I mean? So how can we collectively come together and share resources, right? So if someone has a person that is this community data person that I'm working with every organization. So I think it's just a matter of just putting those things out there. Also, the big piece is around systematically reviewing the data. Like, I think we're really good at collecting data, and then it just sits there. So then how do we say, like, oh, on a monthly basis, we're going to come in as a small pod and we're going to review this data. Like, this meeting right now is really good, and I just hope that it's not a quarterly thing that we can continue to do, because we all have to be, to your point, data people.
Yeah. Awesome. Yep. All right. Who else would like to go next? Right.
Thank you. So until this beautiful young lady joined us, the three of us are all from Nurses for Newborns. So, but what we discussed was funders and how they meet the challenge of getting them the information that they want, and the fact that sometimes they want the same information but in a different way.
Yep.
So there's a lot of that. And then Mia is one of our frontline workers. So she sees the data that she's putting in, and then people will change what they need from Mia. So she then has to report differently than she's been reporting. And how we get, and also the fact that the clinical data is different from the development data, which is different from the executive data.
Yes. There's various requirements around all of those.
Exactly. And they're all, different, and how you get them. And so our analytics team has got a lot of different buttons to push and different things to push. And just sometimes it's kind of like, then it's, as you said, is the story telling, from our point of view in the development department, is telling the story from that data, whether sometimes it's negative, but also hopefully more positive.
Yes.
Oh, did I miss anything?
All right. Awesome. No. Anyone else? Yeah, sorry. Well, we've got people on Zoom. That's why we're definitely using the mic today.
Yeah, hi people on Zoom. So we started with the overall notion that so many of our organizations attempt to get data through surveys, but there's a challenge in getting the people to complete the surveys.
Yes.
And Courtney talked about in his role, there's a middleman that they need, right? They need schools to get kids or students to, complete surveys. But we talked about surveys. People are tired of taking surveys.
Yeah.
And then they don't know what happens with that information. I brought up in my case, the people who do the work are not the people that are not data people. They just want to do the work. They don't want to document things in a system, right? In a database. They don't want to do that. Yes. They just want to do the work. But then there's people who are supporting them who know how important it is to be able to go to a table, to stand in front of people and say, we served this many, we have this many tally marks because we served this many people. And it's there's no solution to that. It's just, I think the solution is understanding it and figuring out what those of us who serve the people who serve people can do about that.
Yes. Yeah. I think that is the unique challenge of working with data in the service space, is because we know those frontline providers are doing awesome, vital work. We also know that some of them, they're not techie people, or they're just swamped, and you're asking them to track a ton more stuff, and they're already like, oh my gosh, my caseload is full. And so, I think here at the network, we do try to take a very thoughtful approach to the metrics we're asking for people. We're always trying to hopefully make it easier for the reporting. I think we've done some stuff with our Salesforce reporting that's made it easier. But I think just recognizing that that's a big challenge. And I think it's, it's one that I see at every org. And I think, unfortunately, there's no easy solution or we wouldn't all face it, right? So, but I think sometimes just acknowledging it can, in my experience at least, make people feel just seen with like, hey, we get that like this is an ask and it's a lift, but also it is important because you do have to be able to say, be good stewards of the resources you have and be able to report out. But it's having that balance can be tough. So, yeah.
I just wanted to add one thing to what Carrie said that I think speaks to a couple of things that folks have said at other tables. Will raised the point of asking the question on the front end about what does that number mean, right? Why? And that gets to the fundamental question of like, why are we seeking X piece of data? Which I think often because we are all caught in the trap of funders need data, they want data, even if they say we're moving away from quantitative. So we're all trying to churn and produce, like, it's like the Moneyball thing, right? We're all trying to produce numbers. And I think that collectively, to Dr. Harris's point, if there could be a process by which all of us convene and think strategically about what are the pieces of information that are most important, A, to tell our stories, B, to understand our impact internally, and C, then to communicate externally about what's really happening in this community, the good and the bad, and the arcs. It's asking the question why, right? What does that number mean? How do we illustrate that number, not just in the figure and in the graph, but also the qualitative storytelling, which gives so much more richness and describes people's lives, which is really what we're all trying to impact, right?
Yeah. Those are really good points.
So I think all the points that I wanted to make were just hit. So I just wanted to foot stomp and beat the table.
Yeah.
While we understand that those numbers are important, information that goes into it are vitally important, at some point, how much data is enough data? If you're spending time pulling your staff away because now they have to go and create this, and then you send it back in and needs more data, or it's not clear what they're really asking for. I spent a lot of time trying to keep that information or that task away from the staff so that they can actually focus on what they're there for, which is the community to serve, right? And oftentimes we're spending a lot of time just moving data back and forth. And I'm like, Jesus, while I can appreciate all the financial donations, I just spent, and I won't say the name for obvious reasons, but I spent about 3 days on a 40-something page document for $2,500.
Oh, wow.
All right. So, right. So, and these are relationships. So you want to keep these relationships strong.
Yeah.
But, and if you're an organization that's budget is built on outside funding, grants, that means you're going to have a lot of outside grants, right? So now you have potentially 30, 40, 50 grants, and you're talking about mountains of just paperwork on top of paperwork, and you're just going back and forth. Now, the last piece of that is that's when it's, in a perfect world, you can kind of get through it fairly, with a little bit of ease, but maybe not. But then there are a lot of challenges when you get to their websites or what they have or what's required. And so it's just it becomes very cumbersome and overwhelming at times. So.
Mm-hmm. Yeah. Yes. Yeah, so I think for us, like when we're going through working with our funded members, people fill out applications, and the thing that I try to tell people is, your data so much, I will never know your data the way you know your data. And so obviously any funding project, you have goals and objectives. And so, ideally, you will all have some sort of metrics that you're going to track anyway, whether I gave you money or not. If you are running a program, you're going to have some sort of metric internally of knowing like, how are we being successful, right? And so that's part of the application. And so what we really try to do is take what you're telling us you're tracking, and that's what we like to just include because you're the expert on your data. But the example I like to give is we do ask for, usually for most organizations, it's like 1 to 3 monthly metrics that they report. And because we never want to take a punitive approach with anyone, but it's like if an organization has a goal, and I'm just making up numbers here, let's just say you're trying to serve 500 people in a year, and after 3 months, you've served 60. Well, we can see that you're probably not going to hit 500. We want to know that so that we can say, hey, what's going on? Is it a staffing issue? Maybe you had a caseworker resign and you're trying to backfill that position. Yeah, that happens. We know that. It's hard to hire people. And so we'll revise the goal if we need to. Or maybe we can help push out your job listing that you've got posted. Or maybe are you having a problem with program recruitment? We have an awesome comms and engagement team here that can help with, if you're a really small org and you don't have that type of support, we can probably help you out, like, create a social media post or whatever. Like, I don't want to make work for Alex here, but, but it's that type of thing where the reason we're asking for those things is to see how are things going and how can we help if they're not going well. And if they are going well, awesome, keep it up. But if they're not, we want to know that, not to, it's not like terrible job. No, we know that when things aren't going well from a metrics perspective, there's a reason for that. And if it's something that we at the network can help with, we're going to do that. Ailey and her team are amazing at making the connections that make things happen, with coming up with ideas for how to problem solve. And that's what we're here for. We want to serve the people doing the service. And so that's what, we want to help make those things happen. And so we know that you all have your goals of serving people. And so hopefully, does that kind of answer like where our head is at with metrics and why the approach we're at least trying to take with them? Oh, sure. Mm-hmm. Yes, that's true. Like I learned so much when we had the qualitative data training. I guess was that last year, beginning of this year. Because that's not my forte, but realizing that there is a way to kind of track those more qualitative aspects. I tend to think of data as numbers, and then I kind of tend to dump it into buckets, which is like program based, like, outcomes for programs. And then I tend to think of more like demographic type of data that can just give you info about like the community and things like that. Or at least those are the two like main types of, quantitative data that I work with. But I think including qualitative data is an excellent point. And I also, one thing that I've heard a lot of you guys say, and that is going to inform some things I'm working on, is making sure we're pointing out the positive. I think that's such an important piece. I'm going to show you guys in a little bit like a dashboard we've put together on some municipal stuff in the 24/1. We know there's challenges. You see the brighter colors of like, oh, this, high poverty area, whatever. It's true. I mean, these are numbers. But there's also, you guys, this has inspired me to make sure that we're linking somewhere on these dashboards some stuff to some of the stories that we tell on our website with our comms team about the awesome stuff that's going on, because there's so many good people in this community and there's so many good organizations like you guys serving them. And so I just want to make sure that we've got a link on there or something that points that out, because I think it can be easy to like look at a map or look at something and be like, ooh, that doesn't look good. But that's not the truth. This is an under-resourced community, but man, there's a lot of awesome people here and they deserve like all good things. And we want to make sure that we highlight that too. So, yeah. I think Alex we have some Zoomers to report on. And then we're going to move. This is like such a good discussion,
Yeah.
But yeah.
Yeah, I know. And we've had a super robust conversation on Zoom. I could read comments for the rest of the meeting. We've had so many. But they've covered a lot of the same kind of ideas here of like helping how numbers are understood and making leadership understand why it's important, to making people at all levels. But I wanted to read one comment that just came through a few minutes ago after listening to many of the concerns brought up here. One of our attendees said, "It's interesting hearing people's perspectives on this because it seems like a lot of data is being used for funding and people aren't able to see as many uses for it for actual process improvement. And if people on the ground could see better links between data collection and process improvement in ways that are helpful for them, they would be more bought in to providing that data in the first place." So kind of
That's a
communicating
great
the
point.
importance at all levels.
Absolutely.
Is one of the topics that keeps popping up. But I'll write all this up in a document for you, Courtney. 'Cause
Okay,
it's
awesome.
been a great conversation on Zoom. So.
Thanks, Zoomers, for participating. We appreciate that. So yeah, and that's the process improvement. That's a great point. I've found implementing new tech can be painful sometimes, but if it's something that makes people's jobs easier, it does help usually. When people see like, oh, this is easier, then, they tend to be a lot more amenable to that. So, okay, for the sake of time, I'm going to go ahead. I had a great conversation over here with Belle, but what I'm hearing, I think, is that the biggest resources that would make an immediate impact would be the ability for us to clone each other and have more of us. So, but this is such a good discussion. So thank you guys for that. We are going to jump into, Morgan's going to talk a little bit about some ways to utilize data, and then I'm going to walk you guys through a couple of data resources. And then Carrie talked about surveys. I do have a really quick survey, but all of your data, like I said, will be used to inform future offerings, but we'll talk about that when we get there. So yes, I'd like to introduce Morgan LeBaige, our data manager, and she will take it from here.
Hi, everybody. Like Courtney said, my name is Morgan. I've met a lot of you before in some of the monthly meetings or mid-year quarterly check-ins, whatever. So if you have any reporting issues or anything, like Courtney mentioned, I mostly work in our Salesforce, so that's all on me. So please feel free to reach out for any of that. Just briefly, I guess, on my background, I've worked in nonprofits for several years. My educational background is in public health, biostats, and epi. So that was kind of my introduction into data and analysis. And I've done a lot of grant writing. So my perspective when it comes to data is a lot from the funding perspective, but hopefully in this, we'll also kind of talk a little bit about maybe what that comment was referring to with process improvement, kind of talking about program evaluations. How can we make improvements to programs based on the data that we're looking at, and also get more funding because we need money. So we'll go straight into it. So I have some questions up here that I'm just going to kind of like talk through, and hopefully this will give good context background as Courtney presents the dashboard that you guys will see, and as we look forward to the survey, where you guys can think about any like gaps, needs that you might have. This is obviously more in the quantitative data space, what we're going to be looking at today, but we can also think about these things. I like to think about both of those types of data working together, so that quantitative data can kind of substantiate, what we're seeing on the ground and what qualitative data and stories that we have collected. So the first one is just asking, so are you serving the community that your programs target? So what, area, what community are you serving? What's that geographic area? We have different data available, whether that's like zip codes, cities, counties, states, etc. So it's important to kind of define that and have that kind of well thought out there. But then moreover, what demographics are in that area? How would you describe that? Which is often something that you have to produce for grants and things like that. But just being able to describe that community. Are your current clients representative of your community? How can you think about that for program improvement? Or are there groups that are underrepresented and why? Which will be important questions to ask as you're kind of thinking about whether you are serving those that you say you are, and how that can be improved. And also if your staff are reflective of that community. So just having those kind of descriptions behind it to be able to articulate that both internally and externally to funders as they ask. in grant applications. Which measurable needs are you targeting? So again, specifically looking at, quantitative data, like what we'll look at in the dashboards that Courtney has. But there's lots of different data sources, the census, the CDC, depending on like what area you're working in. There's a lot of different sources of data, but having kind of a clear idea of what your program is targeting as far as metrics go, where your services are plugging in to help in those gaps and needs, is helpful when thinking through this. And then you can select data also to substantiate the need that that your community is facing. So you know that there's a need, you know that there's a gap, having that data, especially when communicating, externally, but also internally for, program evaluation and things like that, to see if you're kind of making any difference in those metrics, kind of correlating there. But having that quantitative data behind you to say, this is the need, this is why our programs are important, this is how we're helping. And obviously for grant purposes, again, like I said, that's kind of top of mind for me with all of this stuff. That's really important for your statement of need, collecting stories and having that quantitative data behind you to show how you're helping, where you're helping, why that's important, for whom, all of that. Are the communities that you're serving underserved? So kind of combining the last 2 points into one here with knowing your community and then having these different metrics and measures to show where you're intervening and, what gaps and needs that you're addressing there. So knowing what that data looks like in your community specifically. And then combining that with research on other organizations in the community. How are your services differentiated from those? Where are you addressing needs that other people are not? Can you see any improvement? So this is talking about both internally and externally, looking at that data over time. Are things worsening? Are they improving? Can you correlate that to your program impact? Obviously, we cannot say causation from that. And then kind of thinking through that critically, I think, with how I talked about, whether the community is represented among your client base. Kind of similarly, we can think through, if the metrics are, getting worse, why is that? Where else can we expand or improve our program to meet those needs, to help make those different metrics that we're targeting? How can we improve those? What other needs? What are other needs that are connected to those your program addresses or connected to the communities you serve? So similarly, from what I was just talking about, if we see that things are worsening, are people not able to access our programs because of a lack of transportation? What are the other kind of wraparound services or other metrics or measures that might be connected to our programs? And how might we address those again, with program expansion or improvement, and have this as evidence for, hey, if we, want people to be accessing our, healthcare services, they also need transportation to come do that. So kind of making sure that all of the needs of the community are addressed and that people can access your programs. And then I think I will hand it back over to Courtney.
So I'm going to run. This is going to be quick. I was really worried, you guys, that we were not going to have enough stuff to fill up an hour, but I was really wrong. So, because I was like, I don't know, it's Friday morning. Are people going to want to talk? Well, yes. So thank you. But so I will try to not be too rushed with this. But looking at data resources that are available and specific to the 24-1, the geography here in St. Louis as a geospatial nerd is so unique and so challenging in so many ways. And specifically if you're working on funding applications, getting data around so that you can define the community that you're serving and what their needs are and what the status of various metrics is, it can be challenging. So some data is available in zip code, some is by school district, some's by municipality, which of course the 24-1 we know is created for the 24 municipalities in the Normandy School District. Of course, we're down to 22 now, which is progress as far as just streamlining services. And then there's also census tract data, which is kind of the most granular that you'll run across. And all of those have pros and cons. For school district, that's obviously a great division for child-focused and education-focused metrics. Those lines tend to, although not always, follow municipal boundaries. But then it can be hard if you're getting non-education data within that same boundary, if you're trying to do like a direct comparison. Zip codes are really readily available. As a geospatial person, I have to tell you, zip codes, man, they were not designed for data collection. They were designed by the post office. So, but they are so widely used that I've had to make my peace with zip codes. So it's clearly a work in progress. But, you know, they don't conform to municipal boundaries. They don't conform to census tracts, but they're very widely used. And so, like, we know in the 24-1, there's like 2.5 zip codes that kind of form where most of the population is, but there's actually, I want to say it's somewhere between like 7 and 9 zip codes that all have at least a tiny slice within the footprint of Normandy. So that's why zip codes can be kind of rough if you're trying to define an area. Municipal data with cities, I mean, that can be great if you're, you know, if certain programs are just serving a city, you know, around here, like City of St. Louis would probably be the most common example. But sometimes, especially for 24-1 municipalities, it is hard to find that data in an easily accessible way. And then census tracts are great because they are pretty granular. They are designed to have roughly the same amount of population. They get adjusted as things change by the Census Bureau. But the Census Bureau's website, especially if you don't work with it often, is pretty cumbersome. And then some surveys that they do are not available at the tract level or at certain geographic areas just because of like minimum amounts of population for like privacy concerns. So pros and cons with all of those. And so I'm probably not going to click on all of these, but and you guys may or may not be aware of all of these, but for some great existing resources. I'll show these to you in a minute, but I'll just run through them. But Vision for Children at Risk here in St. Louis, they do an awesome job with their data book in their online data center that they produce every few years. And that all of that data pretty much, though, is either at the zip code level or the county level for like the region. And so it's great data. It's so well organized. They do it's a really quality product. I think for the challenge is just getting it down to the level that you need if you're serving a smaller community. You know, when I think of St. Louis County, like it's 1 million people, getting numbers for, you know, the average number or the percentage of people in the county living below the poverty rate. Well, sure, that's a number and it's accurate, but you know, when you map that out at a more granular level, of course, we see areas of concentration and things like that. The MICAs is something that I wasn't really familiar with until I came into this role, which is the Missouri Indicators of, you know, we'll look when I pull up the site, sorry, but it's from the Missouri Department of Health and Human Services. And so this is community health data and it's available at the zip code level. Like I mentioned before, the Census Bureau has a ton. I mean, it's absolutely the most probably comprehensive amount of data, but it is difficult to navigate. And then we are soon, I guess I'm teasing it to you guys today, is that we're launching a new website. I'm not going to show it to you guys today, but I am going to show you we're a dashboard that we've developed that will be on there on our data resources page. So with that, let me get the websites open here. And start. So this is the Vision for Children at Risk. We'll have the links and the slides and all of this when it gets sent out later so you guys can check it out. But you can download like a PDF version of the VCR book here. And let me just flip through it and get to the data real fast. Show you guys like an example. So it's really nice because they have a lot of the demographic data. And they've got the maps on the left and then the tables on the right. And again, this is all by zip code. And then some of the health data is by county for area counties. So great resource. Use this all the time. It's a model for what we're trying to build out on more of the 24-1 communities. So, so shout out to VCR for like just making a great product. They also have this, it's basically the same data. It's just like more of an online format here where you can go down, and this is built in Tableau. So excellent, excellent resource. This is the Census Survey Explorer. If you don't use it all the time, you're probably gonna not like it very much. I will say, I had someone call me like 2 weeks ago and needed some data. If you just are like writing a grant or something and you have a question about getting data, I'm happy to help you out with that. What they needed took me maybe 5 minutes. It was stuff I actually already had for the dashboard, but I could have pulled it really fast. So feel free to utilize me as like your census nerd friend. So, because there's a ton of data, but it gets messy to get through there. Oh, and it's telling me to refresh that. Okay, so this is the Public Health Information Management System, and this is the data MICAs I was telling you guys about. So Missouri Information for Community Assessment. But you can see on here there's info about maternal, infant, and child health, some chronic disease, death rates, ER visits. So public health related stuff, and that's at zip code. They do some metro stuff, but it combines, like for St. Louis, it's just like city, county all smushed together. So not super helpful in general, at least for us, but you can get zip code level data for that. So then, as I said, we're getting a new website. I'm very excited about this. It's going to be great. But I'm not showing it today. So sorry, but embedded in that website will be this dashboard, which is very much a continually evolving product. The challenge with a dashboard like this is that there is so much data, and especially for me, it's just really hard to narrow it down. It's like picking your favorite kid if you had a bunch of kids, maybe. I don't know. So there will be a lot more functionality added to this, and my hope is maybe, quarterly or something like that in our monthly newsletter, we'll be putting an update of like, hey, check out these new maps or this new feature on this dashboard, but it'll always live in the same place with the same link on the website. But the nice thing with this is it is all of the municipalities in the 24-1. You can see it's got this red line, which is the border of the Normandy School District. And for these areas where it looks like we're missing a little puzzle piece, so that is actually unincorporated St. Louis County. So there's still 23 municipalities on here because we haven't had new census data since Gleneco merged into Normandy. And a next feature that will come out eventually is we'll have counts for the district as a whole. And then what we'd like to do is basically it'll be a calculation for those unincorporated areas as well. But for all of these, so we've got over here, I've kind of just sorted the different maps into 3 main categories. You've got demographics, social and economic characteristics. And then you're able to just click on your city and it lets you drill into like the more specific data there. You're able to come up here and like export the data out if you want. I'm also going to add a button where you can just export the whole table versus like what you've selected. And so that's that. So very soon you'll be able to access this and play around with it. Please feel free to send suggestions and things that you would like to see added to this, or if you think something's not working or whatever. So yes. Yes. Absolutely. I would love. So the question for Zoom people was if we're going to create some more data visualizations and if there's an opportunity to help guide this. So yes and yes. The next kind of feature that I'm adding in and didn't get it added in just yet, I'm working on it, is so this is and it tells you on here in the details, but so this is all the most recent ACS 5-year estimates. We want to add in historical data. So like one example of a potential visualization I'm going to add in is looking at the change over time. It would be an example. Adding in some like more kind of like, bar charts of breaking it down by age or breaking it down by race, that type of stuff. So this is like a very much continually evolving thing. And I would love to get feedback on that type of stuff. So, and the ACS is the American Community Survey, which is it's kind of, aside from the decennial census, it's usually your best bet for getting estimates for social characteristics of populations. And so, man, you guys, it is 9:59. I cannot believe that, which is crazy, but I want to be respectful of everyone's time and let you guys out on time. Let me see if I can get this back to sharing. Let's There we go. So, like I said, touching on surveys, like Carrie said, I would love it if it is like a 4-question survey. It's very brief. It just basically says, how much do you use data in your job? There's 2 questions about like what types of resources or trainings you would be interested in. And then the last one is if you have a certain specific challenge, like put your email in there and Morgan or I will reach out to you and find out what's going on and if there's something we can help you with. But that's it. So, I'm not going to sell your data to Google. But if you guys would take that, I would really appreciate it. We want to provide things that you guys find useful. Hopefully you found this morning useful. I have to say I loved the conversation. I thank you all so much for your thoughtful contributions. Like I said, I've already got an idea of really wanting to make sure that we're putting some more narrative elements into that dashboard or at least on our data resources page so that people can see the strengths of our community in addition to the challenges. I just really thank you all for taking time on a Friday, no less, and first thing in the morning to come and talk data. Please feel free to reach out anytime and just hopefully you all think of Morgan and I as an extension of your data team. If you do have a data team or if you don't have one, you can just think of us as your data team. But we really want to be here to serve you guys. So if there's nothing else, I think we're right at 10 o'clock. So thank you guys. Feel free to take more snacks or coffee, and thanks to everyone on Zoom. And with that, I will let you guys go. So thank you.